what would you say has been the most challenging part of contact tracing in Spokane County?
It is, I would say, volume of cases has a direct impact on ability to do contact tracing. We assume that every case probably can name between 7 and 10 people that they've had contact with. So when we're at 514 cases yesterday, that means we're at 5,000 contacts.
With that current situation, I mean, you mentioned 5,000 contacts. What does that conversation look like now?
It's very brief. It has been brief for some time now since we've been at these really big numbers. The contacts that we want to directly follow up with are people that have been the case has exposures in a high-risk setting. So congregate living is a really good example right now, which includes shelters, long-term care environments. So that's really our shift in focus. And then for all of the other contacts, that contact tracing is still being encouraged to happen. But like you mentioned, we really would like to support cases in reaching out to their own contacts.
Is there a scenario that seems most common of how they're contracting it? Are they gathering at these parties? I guess, what's the most common way you've seen?
It's small gatherings. I think people are doing, in general, an okay job of limiting not being part of big celebrations, but even a smaller celebration of 5 or 10 people, of people that are not part of their daily household.
What do you find to be the most frustrating part of this process now 8 months into this pandemic?
I think the biggest frustration is that much of what we're seeing in terms of case numbers increasing is largely preventable if we are being diligent as a community to the protective measures.
Amanda Rowley, KREM 2 News.